Eggs have long been at the center of debates about heart health, largely because of their cholesterol content. Yet modern nutrition science has steadily reshaped how we understand their true impact on the cardiovascular system. For many years, eggs were viewed with caution and sometimes even fear due to the assumption that dietary cholesterol directly translated into higher blood cholesterol and increased risk of heart disease. However, extensive research over the past 2 decades has revealed that this relationship is far more complex, and for most healthy individuals, moderate egg consumption is not only safe but can be part of a heart-supportive diet. One of the most important distinctions clarified by recent research is the difference between dietary cholesterol and blood cholesterol. The cholesterol found in foods like eggs does not automatically raise cholesterol levels in the bloodstream. In fact, the liver produces the majority of the cholesterol circulating in the body, and when dietary cholesterol intake increases, the body often compensates by producing less of its own. For most people, this regulatory mechanism keeps blood cholesterol levels stable. Studies have consistently shown that eating eggs has little to no effect on total cholesterol for the majority of individuals, and when changes do occur, they often involve an increase in HDL cholesterol, commonly referred to as good cholesterol, which plays a protective role in heart health. Eggs also influence cholesterol balance in a more favorable way than is often acknowledged. Research indicates that egg consumption can improve the ratio of LDL to HDL cholesterol, a key marker used to assess cardiovascular risk. Even when LDL cholesterol rises slightly in some individuals, the particles tend to become larger and less dense, a form that is considered less harmful to the arteries. This shift toward larger LDL particles is associated with a lower risk of plaque formation and arterial damage. In this context, eggs may contribute to a healthier lipid profile rather than undermining cardiovascular health. Beyond cholesterol, eggs provide a rich array of nutrients that actively support heart function. They are an excellent source of high-quality protein, which helps maintain muscle mass and supports metabolic health, both of which are important for reducing cardiovascular risk. Eggs also contain choline, a nutrient involved in lipid metabolism and liver function, helping the body process fats more efficiently. Additionally, eggs supply antioxidants such as lutein and zeaxanthin, which are increasingly recognized for their anti-inflammatory properties. Chronic inflammation is a major contributor to heart disease, and foods that help reduce oxidative stress and inflammation can have a protective effect on the cardiovascular system. Eggs are also naturally low in saturated fat compared to many other animal-based foods that are more strongly linked to heart disease. When prepared in simple ways, such as boiling or poaching, eggs can fit comfortably into heart-conscious eating patterns. The overall dietary context matters greatly, and when eggs are consumed as part of a balanced diet rich in vegetables, fruits, whole grains, and healthy fats, they complement rather than compromise heart health. Many large population studies have found no significant association between moderate egg consumption and increased risk of heart disease or stroke, reinforcing the idea that eggs have been unfairly singled out while other, more impactful dietary factors were overlooked. Another important aspect of the myths versus reality conversation is how eggs compare to typical breakfast alternatives. Replacing eggs with highly processed foods high in refined carbohydrates and added sugars can actually worsen cardiovascular risk markers, including triglycerides and insulin resistance. Eggs, by contrast, promote satiety, help regulate blood sugar levels, and reduce the likelihood of overeating later in the day. Stable blood sugar and insulin levels are closely linked to better heart health, especially for individuals at risk of metabolic syndrome or type 2 diabetes. Recent research has also explored egg consumption in specific populations, including older adults and individuals with existing cardiovascular risk factors. While personalized nutrition remains important, the growing consensus is that for most people, consuming up to 1 egg per day or even more within a balanced diet does not increase cardiovascular risk. In some cases, eggs may even contribute to improved nutrient intake and better overall diet quality, both of which are associated with improved heart outcomes over time. The evolving understanding of eggs and heart health highlights a broader shift in nutrition science away from focusing on single nutrients in isolation and toward evaluating whole foods and dietary patterns. Eggs are a whole food with a complex nutritional profile, and judging them solely by their cholesterol content ignores the many ways they support metabolic and cardiovascular health. The reality is that heart disease is influenced by a combination of factors, including inflammation, insulin resistance, lifestyle habits, and overall diet quality, and eggs, when consumed in moderation, do not emerge as a significant threat within this broader picture. In conclusion, the long-standing myth that eggs are harmful to heart health due to their cholesterol content is not supported by the weight of modern scientific evidence. For most healthy individuals, moderate egg consumption is safe and can be part of a heart-healthy lifestyle. Eggs provide high-quality protein, beneficial fats, antioxidants, and essential nutrients that support cardiovascular function while helping maintain balanced cholesterol levels. When enjoyed as part of a varied, nutrient-rich diet, eggs are not an enemy of the heart, but rather a practical, affordable, and nourishing food that fits comfortably into modern recommendations for cardiovascular health.